It was scary. I didn't know anything. I wasn't angry at the time because I was just scared and I wanted to get better.
How did this happen? You know, I was young. I did all the right things. I ate very healthy. So it was very overwhelming at first, almost like a bad dream.
Still to this day, 7 years later, I have no recollection of those 8 days in the ICU.
From my mom's side, there was always that memory of cardiovascular disease that fueled her desire to do better for her family. So hopefully I'm kind of paying that forward both professionally and personally.
After my transplant, I was afraid to talk about it because I thought people would see me as different.
The scariest part of it is not knowing what was going to happen afterwards, whether I was going to survive or not.
I had my son in end of September. In the beginning of August, I started developing a cough. And it progressed quickly to the point it would make me sick. Finally, I went into labor. I was home. I noticed my lips were a little blue and my skin looked a little yellowish. And I really couldn't breathe at all at this point. I was diagnosed with peripartum cardiomyopathy. I was told I have congestive heart failure and I can't ever have another baby. And I don't know why I'm crying, it's so long ago. But the silver lining was that when they said I couldn't have another baby was that I had a future, because I didn't understand what congestive heart failure meant. I thought, oh my gosh, you know, that's crazy to hear at 34 years old that here I'm so healthy and I could have died. My cardiologist, Dr. James Fang, said, no, we're not ruling out future children. He said, but you have to make a full recovery before we can say it's okay. My oldest, when this happened, he's now 9. My second is 6, and my third is 3. So they're all at fun ages.
I had breast cancer in 2013. I just had my 30th birthday. The chemotherapy itself was one of the #1 chemotherapies that would potentially weaken my heart. And our family had a history of, you know, heart attacks and things, so I was just very concerned about my heart, and that's when she recommended me to go see a cardiac oncologist. Dr. Oliveira right away said that I should go on something that would just kind of help my heart rest while I was sleeping. And so after I started this drug, about 3 months into it, he said that my heart was already at 100% functioning. I wasn't as worried about myself as I was my kids. So I was really worried about their future, you know, who was going to help them make their lunches and all those things that you don't even think about, you take it for granted. But I was really just determined to be healthy, to be there for my kids and to help raise them, and it was my faith too that just got me through it.
My heart stopped out of the blue. I was having lunch with a friend and told her I didn't feel well. And the next thing I knew, I didn't know because I went into a coma, I guess, for 6 or 7 days. My heart had stopped. Luckily, there were 2 doctors in the restaurant that revived me with CPR. I had had Hodgkin's disease back in 1974, and I had radiation. The radiation left lots of fibrosis in my body, and that's what clogged my arteries and my heart. I've had a few setbacks. Twice they put in stents. Twice they had to come out because 6 months later they were 96% clogged. So then they finally had to do a single bypass. I feel like myself when I'm out on the golf course and spending time with my grandchildren and spending time with my friends and being with my family. It's knowing and listening to your body. Your body will tell you when you need to see someone.
I was tired and fatigued, and I would have difficult breathing and that. And That's when our local doctor evaluated that I had cardiomyopathy. I did not think I would need a transplant. I just thought they were going to be treating me with medicine and that. It started in November when I was put in the hospital. My heart started racing, and the only way they could make it stop racing was to use the paddles on me. And that third time they did that, and then I told the doctor, I think you're right. I need to have the transplant. You can put my name on the list.
I was in 8th grade, 13, 14 years old. My understanding of it was that Mom wasn't going to be home for a while. And I wanted to know when she was going to be here, especially during the months that she was in during the holidays. That was rough. That was rough.
I was the 5th person to have a heart transplant at UH, and I thought they're going to put a heart in and I'm going to go home. Well, that wasn't, you know, you have the difficult surgery and then you have recovery. And so I really didn't come home from the hospital until the middle of January. I've got to see my 3 daughters grow up, and I've got to see 4 grandchildren.
The year of my 30th birthday that I noticed that I was having heart palpitations, racing heart issues. It wasn't until after I had met with the cardiology team and the word cardiomyopathy had come up, then I realized that similar situation to my mother. Same disease, but for different reasons.
It was a really big shock that I had found out that my daughter Meredith needed a heart transplant.
My defibrillator had shocked me at home. I met the doctor at the ER. She said, okay, we're gonna keep you for a couple days. The next morning, my defibrillator went off in my hospital room. Shocked me again. This time a lot stronger than the day before. And the transplant team came to my room and said, you will stay here until we find you a heart. A week later, and they found a heart for me. April 6th of this year. Seeing my nieces and nephew grow up is very important to me.
I'm enjoying life now with bowling. Wednesdays is our bowling day, and that it keeps me busy. I've gone to 4 transplant Olympics, and I've taken 3 gold medals, a silver, and a bronze.
You need to have the family support. If you don't have the family support, it's going to be difficult to get through something like this.
People don't always know what they need to do. And I feel as if, particularly as medically, knowledgeable people, if we can share that knowledge, people can do better. So when we talk about the Go Red mission, knowing your numbers, knowing your blood pressure, your cholesterol, those things are so empowering, because you're like, you know what, I have cardiovascular risk. And if I know that, I can learn how to make these risks less, how to minimize my risk. And try to be an example. None of us are perfect, but everyone can help someone kind of advance their own care.